Hi everyone, my name is Maya Trombley, and today I'm going to be going over my patient experience internship for HCA 481. So a little bit about the organization that I was a part of. It's called Compass One Healthcare, which is one of the major support service specialists that contract in hospitals. Now, they have a bunch of different sectors, but a few of them include environmental services, patient transport, technology solutions, maintenance, linen, ambulatory, sterile processing, and patient observation. For my internship specifically, I focused on environmental services, or EVS, and this was done at Long Beach Medical Center and Miller Children's and Women's Hospital. So I'm actually a current employee at Long Beach Medical Center, so I was able to meet my preceptor through previous networking that I had done. We did have a brief interview to kind of go over the expectations of the internship, but there was no formal recruiting or onboarding process. For the orientation itself, she gave me a brief overview of the company and her position. She also walked me through what the internship would be like. This was also the time that she introduced me to her leadership team. Now, some of the work activities that I had done are patient rounding, service recoveries, nursing engagement, nursing celebrations, employee engagement, in-services and trainings, updating the data board, analyzing HCAP scores from Press Ganey, and also planning and coordinating EVS Week. I developed a lot of skills during my time here. Some of the soft skills that I developed were communication, documenting, leadership, networking, collaboration, compassion, and conflict management. Some hard skills that I developed were spreadsheet building, public speaking, explaining, conversing, data visualizing, organizing, and interpreting. One of the biggest projects that I got to take part of during my time here was EVS Week. And this is pretty much a week out of the year that this group is able to appreciate all of the EVS workers. And so I was given the amazing opportunity to plan, coordinate, and execute all of these activities. So I was able to plan activities for each day of the week, and I did this by collaborating with other departments to be able to execute games and also all of the food events that we did. It was also my responsibility to budget for the food and prizes and ensure that we were allocating our expenses appropriately. This was also a time for me to engage the staff and appreciate them for all the hard work that they've been doing. On the left-hand side, you'll see the scavenger hunt that I created, and this was an activity where they would go around the hospital and ask some people questions to get their answers, and then they would bring this back down to us and we would give them a prize. On the right-hand side of the screen, you'll see some EVS Week belly events, and these were all of the food events that we gave out to them each day of the week, and this was a collaboration with our food and nutrition department. These are some ways that I contributed to the organization overall. I was able to help create better processes for quality improvement, create and develop new ways for staff appreciation. I demonstrated my willingness to learn, participate, and lead teams, and I also brought a new perspective and outlook to the team. Some key takeaways from my time here was that I really expanded on my knowledge of the healthcare field. I also was able to learn more about professionalism and how to present myself in organizations like this one. I was also able to gain some more career clarity and see what I want to do post-graduation. And best of all, I was really able to network with a lot of individuals and get to know people on different units, and I met a lot of really cool people during my time here that I really hope to stay in contact with. So what's next? After graduation, I'm hoping to apply for some of these patient experience manager positions. I'm also contemplating either applying to nursing school or applying to grad school. And I think during this internship, it really taught me what a huge impact nurses have on our health system and how much they care for our patients. And that really developed a strong passion inside me to be the same way, so I'm really torn between either going to grad school or applying to nursing school. So I'm going to take a little bit of time to work as a PEM and strengthen my skills and knowledge before I decide one way or the other. Some skills that I would like to develop are public speaking, confidence, and leadership. And I hope to follow through on these things by taking LinkedIn learning courses, gaining hands-on experience, possibly doing a mentorship program, and continuing my education. Some ways that I can continue to develop and grow are to focus on my transferable skills, seek out experiences and opportunities that get me out of my comfort zone, and also learn from my mistakes, but also learn from the amazing leaders that are surrounding me within these healthcare organizations. And that's all I have. Thank you all so much for your time.